A hemorrhagic stroke is a different kind of stroke which is due to a broken blood vessel that supplies the brain with blood. Blood will escape from the broken blood vessel and bleed into the brain tissue or the space just outside the brain. A hemorrhage is a medical term for a bleed, and if the blood enters the tissue of the brain from the broken blood vessel, it's called intracerebral hemorrhage. Intracerebral means inside the brain. Symptoms of an intracerebral hemorrhage stroke are similar to those for an ischemic stroke, and if they occur, it is important to seek medical help immediately. However, if the blood enters the narrow space between the surface of the brain and the brain covering, which is called the subarachnoid, it is called a subarachnoid hemorrhage. People who have experienced a subarachnoid hemorrhage usually develop a sudden, very severe headache, which they describe as being hit on the head with a hammer, or the worst headache of my life. Sometimes the person may also experience vomiting, a stiff neck, or temporary loss of consciousness. Any severe headache with no known cause that comes on suddenly requires urgent medical attention. Blood vessels may become damaged or broken for many different reasons. High blood pressure or hypertension can damage blood vessels, causing them to break. This is why it is important to make sure blood pressure levels are controlled. Blood vessels may also break because part of the blood vessel wall has been weakened, causing it to balloon out due to the blood pressure or other factors, for example, smoking. The ballooning of the wall of the blood vessel at the weak point of the vessel is called an aneurysm. An aneurysm can rupture, causing a bleed, causing a subarachnoid hemorrhage or an intracerebral hemorrhage.